So every day I'm getting patients asking me, doctor, should I undergo bariatric surgery or should I try the newer drugs, the GLP-1 analogs for my obesity? It depends exactly what you want and whether you are well informed or not, and the information that you need to have before taking that decision, a joint decision based on some knowledge and data. And these are: one, you must know that the drugs that we're talking about, Ozempic and Mounjaro, these are drugs which work while you are on it, which means if you stop taking these weekly injections, the weight is going to come back. Therefore, knowledge that this is a long-term or maybe lifelong medicine is very important to know before you embark on it. Number two, the cost of these injections on a monthly basis seems to be about 15,000 to 20,000 rupees, and therefore if one can afford spending that kind of money, of course, then it is something that you can do. Number three, there are certain side effects of this medicine like nausea, vomiting, bloating and reflux and constipation, and very few patients may develop acute pancreatitis, and therefore you have to take this medicine under supervision. Do not make the mistake of thinking I can buy it over the counter and use it. It's very simple. What can go wrong? Well, you have to be under medical supervision while you take this medication. And finally, you have to realize that it all boils down to how much of weight loss you want. The medicines typically give you 15 to 25% of weight loss over a period of a year and a half. That is what the data has been shown from the research. Whereas bariatric surgery gives you about 30 to 40% weight loss in about the same time. And most patients will maintain it with a single shot surgery, which means that you are getting a higher weight loss and also a more durable weight loss, sustained weight loss compared to the drug, where you have to give it repeatedly and you can get a weight loss which is less than what the surgery gives you. Of course, it is important to remember sometimes we do not need that kind of a drastic weight loss. Sometimes it's okay to have about 15% weight loss. For example, if you want to control your diabetes, 15% is good enough. But if you want to control your liver disease, early cirrhosis, then probably you need a higher weight loss. Maybe for arthritis, where you have a lot of joint pains, then you need a high weight loss. So remember that it all will depend on the clinical situation. There was a patient recently who has got a big hernia and this needs a surgery, but if the patient was put on medical therapy, A, some patients do not lose as much weight, and two, it takes time, where the surgery can give you a predictable drastic weight loss in 6 months. Therefore, for that patient, we chose bariatric surgery. So this was just an example, and there are many such instances. So when you are faced with such a problem of deciding between medicines like Ozempic and Mounjaro versus bariatric surgery, remember there are many factors that can influence this decision. Make sure that you are having a discussion with your health practitioner or your bariatric surgeon or your endocrinologist or your obesity nutritionist on this particular subject with those factors that I have mentioned in this video. Thank you very much for watching.